Hello, everyone. Welcome to Black Girl Health Collective's community session. Happy Monday. We are so excited to have you all here for this critical conversation where we are talking about Black women, a Repro revolution. So we are going to be covering a couple of topics. I'm here today with Dr. Jamila Perritt. She is the CEO of Physicians for Reproductive Health, and she has graced us with her presence and all of her knowledge to just pour into us in our community and share exactly all of the things that are coming up. How we looking back on 2 years since the Dobbs decision, and then also what's it looking like looking forward? How are we navigating, especially in a time when we are just completely exhausted and
Mhm.
worn out and burnout, and like how we're going to navigate as a community. So I just want to take a second to introduce Dr. Jamila Perritt to the space. Dr. Perritt is a fellowship trained board certified obstetrician and gynecologist and the president and CEO of Physicians for Reproductive Health. She's a community based provider who operates at the intersection of sexual health and reproductive rights and social justice. She provides a unique perspective as a Black woman clinical provider and leader of a prominent organization focused on amplifying the voice of medical providers to advance sexual and reproductive health rights and justice. She's a collaborator with Black Mamas Matter Alliance and a fellow of the American College of Obstetrics and Gynecologists and the Society of Family Planning. She serves via mayoral appointment as a chair for Washington D.C.'s Maternal Mortality Review Committee, and has previously served as a vice chair for the ACOG Committee of Health Care for Underserved Women. So thank you so much for joining us, Dr. Parrott.
Thank you so much for having me. It's a pleasure. I love the Black Girl Health Collective and your work, Brittany. So it really is a privilege and an honor to be in conversation with you today.
Yes, thank you so much for being here. So, we at the BGHC, we like to create spaces where we can have dialogue and community discussions and really bring center health and awareness and advocacy as well. So, reflecting and looking back, it's been 2 years since Dobbs, and the world definitely feels a lot different.
Mhm.
So, I just want to know what your thoughts are on like not only the impact to the repro health space, but also, systemic racism. Everything
Mhm.
feels so critical and overwhelming at this point. And, there's been numerous changes, just to name a couple: the abortion bans and like the criminalization. And then also this kind of IVF and
Mhm.
embryo personhood dialogue that's happening in Alabama and other places as well. So just wondering your thoughts as you reflect on these past couple of years, what comes up for you as not only a Black woman but also a provider?
Sure. So thanks for that question. I think the first thing that I would say, we are looking at exactly as you said, the way that you framed it. We're 2 years since the anniversary of the Dobbs decision, but I think it's important to understand that the assaults on our reproductive rights and our bodily autonomy did not begin with the Dobbs decision 2 years ago. This has been really a long-standing fight and something that I've been engaged on for the entirety of my career. And so many organizers, in particular, Black women and femmes in the South, and from community based organizations, have been organizing around since Roe was decided in 1973. You mentioned things like abortion bans. Those things have been sweeping the nation, certainly more so than the last 2 years. And not just bans, we're talking about gestational age bans, provider bans, deciding where you can have an abortion, who can provide your abortion, who can deliver your babies, where you can deliver your babies, whether or not you have access to IVF services or infertility treatments writ large. And all of these things, exactly as you rightly pointed out, Brittany, directly impact Black women and birthing people more so than any other community. We know the statistics around maternal mortality. Black women are 3 to 4 more likely to die during pregnancy and the postpartum period than our white counterparts. And it doesn't matter our education, it doesn't matter our income. All of these things have been long-standing struggles. The Dobbs decision absolutely brought so much of this conversation to the forefront. And so, as devastating as it has been, what we have seen are more folks becoming engaged in this fight and engaged in this conversation because it is becoming much more public. And it's challenging though, right? It's overwhelming. You talked about like all of the issues that we're dealing with, and it can be tough really to hold space for all of those things. Our communities are struggling. They're struggling to access culturally grounded, community responsive care from people who speak their language, who look like them, who understand their lived experiences. We know that that concordance, right, matching of race, matching of ethnicity, matching of language improves outcomes for our communities. And so those struggles are real, and Dobbs absolutely made it worse. I think the last thing that I'll say about that is that we can both grieve the loss of federal protections for Roe and also acknowledge that Roe was never enough. It never provided the care that our communities needed. There were always people who were left out of their ability to access this care. And so Roe was the floor. And now we are in the sub basement. We are way below the floor now in terms of where we're falling. And some communities will continue to feel the disproportionate impact of that. Certainly Black women and folks with the capacity for pregnancy, Indigenous folks, as well, young people, LGBTQ folks. We're here in the beginnings of Pride Month, and our LGBTQ siblings are also experiencing disproportionately poor reproductive health outcomes, unable to access abortion care, reproductive health care more broadly. So really thinking about the impact, we have to zoom out. It is bigger, deeper, more long-standing than the Dobbs decision, and Dobbs dealt a devastating blow.
No, I appreciate you sharing that. I'm thinking about where we're positioned and saying that we're in the subfloor.
Yeah,
And I think we need to have a more expansive lens, especially when we think about like the impact of this. It's not just women.
that's right.
It's way larger than that.
It,
And I
it is.
appreciate you referencing, it's Pride Month. What does this look like now? What does it look like in the future for people and communities that are on the margins, that have always already had a struggle
Exactly.
accessing care? So,
And we think about the way that folks are left out of conversations about reproductive health, who are unable to access reproductive health services. We know that it is not just people who identify as women or girls who have the capacity for pregnancy, who have disproportionately poor reproductive health outcomes. So it is critical to me and to the communities that I care for that we are as expansive as we can be, as
yes.
expansive as we should be in having these conversations. And not just the way we talk about it, but the way that we live the reality of what it means to access reproductive health services, what it means to practice reproductive justice in our daily lives. And so thinking about just even something that seems as trivial as our forms when you go to your healthcare
Yes.
provider to get care, the way that we're referring to folks and assuming that they use specific pronouns, or that they identify in a specific way, or that their sexual activity is tied to their gender expression. All of those things absolutely shape the experiences that people have when they come to see us as healthcare providers. And those negative experiences, they keep people from care. So it behooves us as healthcare providers to really do the work that we need to. It is not our patients' jobs to teach us how to take care of them. It is our responsibility to do this work in a way that is grounded in justice and agency and autonomy.
No, I appreciate that. I truly believe that it is the work of the systems to pivot,
That's right.
be able to meet the needs of the community, and it not be held on the
Hmm.
responsibility of the community. And so
Yeah.
thinking about all of these things and us being in the subfloor, of of care, what do you think is the impact of this on the future? Like, what does
Mm.
the future look like for us as a society, and your thoughts around this space and around this work?
It feels a bit dystopian. I will admit. I think where things are going to get a lot worse before they get better, and I want to be able give a silver lining or to lead with optimism. But the reality is that many communities, many individuals are going to suffer. For folks that are unable to access abortion care in their community, they only have one of a handful of options. They carry a pregnancy that they have clearly said that they can or do not want to continue to term. And we know the results from the Turnaway study and robust research, the implications of forced pregnancy when people are seeking abortion care and unable to do so. It has long-term intergenerational um, conflict. It harms for our communities. We're talking about folks that are more likely to be tied to abusers and intimate partner relationships, people who are more likely to be thrust in or to remain in poverty, folks who are unable to care for the children that they already have. More than half of people who seek abortion care are already parenting. They already have children. And so we know that the ability to care for the children you have is a big deciding factor. And so we think about the forced pregnancy that people who are unable to travel, unable to access self-managed abortion, for example, in their own community safely, are going to feel the impact of that. And so I think about that a lot. I think the future also holds, and you mentioned this a little bit earlier, Brittany, the risk of criminalization for folks because of their pregnancy outcomes. We know that the criminal legal system targets, surveils, arrests, and prosecutes some communities disproportionately. Black and brown communities, LGBTQ folks, especially trans folks, are targeted by the criminal legal system for criminalization and prosecution. We know young people, we know folks living on low incomes, people in rural communities. So the risk of criminalization for folks that are seeking care outside of the medical system or even having routine care but experiencing poor pregnancy outcomes will absolutely increase. And so I see that in the future. I think though also, and I would not be true to my Black feminist roots if I did not bring in an opportunity to dream, right? And so why I see all of those things as real possibilities and real likelihoods going into the future. I also know that Black feminism's taught me that we have to believe that there is something beyond that. We have to dream greater than that. And I think that as devastating as this moment in time is for all of the reasons, we also have to keep our eye on the future. We have to think 7 generations in advance. And what that means to me is dreaming of something bigger and better than this, because it is what our communities deserve.
I appreciate that, because I was going to ask, like, what are your thoughts? Like, you touched on everything, like what fills you with dread, and then also what kind of gives you hope. And I really appreciate that, because I think the future and where we are presently was at one point someone's dream, right?
That's right. That's right.
And so holding on to that and grounding in that, and just wishing best, and like you said, thinking down generationally. We can't just think about tomorrow and right now.
That's right. And I think that, it's important to understand exactly as you said that, our foreparents, they dreamed of us, that we would be here doing this work. And so it behooves us all to think about what the world could look like. Mm-hmm. We're talking about survival pending revolution. We know the system doesn't serve us. It never has, and it won't in its current iteration. But we still need to survive these systems in order to get to the point where we can thrive and where we have the joy and agency and autonomy that we and our communities deserve. And so that means doing the work of survival while we're dreaming of something different for us. And I think, this moment, as hard as it is, right, it is an opportunity as well. Because, as we've said, the system as it exists, it did not serve us all. It wasn't designed to, let's be clear. It was never meant to serve us. And so it's doing exactly what it was designed to do. And this is an opportunity to rebuild. And the question becomes, when we build a new system where people get to deliver their babies in the place that they want to, in the community that they want to, surrounded by the people that they want to assist them in this transition earth side. While we're waiting on those things, while we're waiting on people's ability to be able to access abortion care in their community, whether it's through a doctor like me or the midwife or a nurse practitioner or a community-based abortion provider who has been providing this care and healing for generations.
Yes.
While we're waiting for those things, we still have an opportunity now to rethink what the system looks like, right? And so when we're fighting that fight and we're arguing for birth justice, when we're arguing for abortion justice, and the question that we ask ourselves over and over again, the question that I ask myself is this liberatory? Who are we centering? So whether we're evaluating, suggested policies or procedures or ways to move through the work, the question of developing liberatory medical systems to me is a big one. And that is what I dream of. That is what I think we can and we should build.
No, I appreciate that. I think one, that's a word. I would love to see. I think that is for me essentially like the North Star of making sure that people are able to access care in a way that they desire and how they desire.
Mm-hmm.
And so I think that also there are a lot of people that aren't immersed in the reproductive health and justice space. And like thinking about that, they're like, I don't know what's happening and why I should be concerned. So I'm just wondering, what are your thoughts about that? Or is there anything critical that we should focus on when we are out here trying to spread awareness and the word of like, we need to get energized around this?
Yeah, I think a couple of things. We've mentioned the term reproductive justice a couple of times in the conversation. I think it's worth talking about what that is. And we are here. We just celebrated the 30th anniversary this weekend of reproductive justice, honoring the 12 mothers of the movement. And so if you would indulge me, I'll take just a couple of quick minutes to talk about what that is. So often these terms, reproductive health, reproductive rights, and reproductive justice, are conflated. And the longer I do this work, the more I see that happen. And so I think it's worthwhile being really clear about what we mean. Reproductive health typically deals with the functioning reproductive health system, right? Our ability to be well. So thinking about doctors like me, our nurses, our advanced practice clinicians, but also researchers and scientists who are building the body of evidence, right? Thinking about reproductive health, healthcare delivery. Reproductive rights has typically focused on protecting the legal right to make reproductive healthcare decisions. And it is typically really centers on accessing abortion and contraception services. And so when we think about the actors in that space, these are litigators, our policymakers, right? The folks at ACLU, CRR, the Lawyering Project, who are doing really amazing work to ground us in the litigation, right, to protect our rights. Reproductive justice, on the other hand, places reproductive rights within a social justice framework. And I mentioned that this is a 30th anniversary. Reproductive justice was founded in 1994 by 12 Black women who met at the Illinois Pro-Choice Conference in Chicago, and they were talking about their lives and experiences as Black women in this world, and recognizing that often we are left out of conversations about reproductive health and out of the room when reproductive decision making in terms of policy is happening, and not wanting to use the language of choice, which was prominent at the time, given that they represented communities with so few real choices. Instead, they really merged this reproductive rights, social justice, and importantly, human rights. Reproductive justice is a human rights framework. And that matters because human rights are indivisible, right? They're universally held. So you are entitled to these rights because you are a human being. It is not dependent on your age, your income, your national status, the language you speak, right? Everyone everywhere is entitled to them. And your ability to actualize one human right is directly tied to your ability to access and actualize another one. Reproductive justice also rests on centuries of Black feminist thought. So thinking about Sojourner Truth, Mary Church Terrell, folks who really centered the experience of Black women in their advocacy and their organizing and their activism, and really was built upon by Black feminists and womanists in the 60s and 70s, like Audre Lorde, Beverly Smith, Barbara Smith, right? Who and Francis Beale, who talked about the double jeopardy of being both Black and female as part of the human condition. All of that is reproductive justice. And it rests on four core tenets, right? Every person has the human right to determine if they will have a child and to determine the circumstances and conditions they will give birth. Every person has a human right to not have a child and to have the information and resources necessary to prevent or end a pregnancy. Every person has a human right to parent the children they already have in communities that are safe and sustainable and free from violence from the individual and the government. And every person has the human right to bodily agency and autonomy and the right to disassociate sex from procreation. And so, what that centers is joy, right? People have sex for lots of reasons, but mostly because it's fun, it feels good, right? And we deserve that joy as well. It does not have to be tied to procreation. So, when we think about reproductive justice, we understand that these four pillars are tied. We cannot talk about abortion justice without talking about birth justice. We can't talk about birth justice without talking about environmental justice. We can't talk about environmental justice without talking about economic justice. All of these things are connected in the lives of our patients, and so they have to be in our work as well. And so when I look at folks that are becoming newly activated, I think about my activation along in learning about reproductive justice. It was something that I didn't learn about in medical school. I didn't learn about in residency. I hadn't heard of in fellowship. It was when I was way out into practice and I had the privilege of meeting Dr. Tony Bond and Loretta Ross, Professor Loretta Ross, who introduced me to this term. And it changed everything for me because as someone who knew I wanted to be a doctor when I was a kid, I also knew that the system was not designed, it wasn't set up for us to be well. And reproductive justice is a much more nuanced, a much more complicated and complex theory that can be converted into praxis, and I believe truly will save us all.
No, I appreciate that so much. I think, especially from someone who's been in the reproductive health and justice space, I think there is so much confusion about each of those frameworks and exactly what the impact is. I also feel like this is definitely the space that I will continue to be in for the rest of my life
That's
once I'm
right.
first introduced to it.
Yeah.
Because I think there a lot of work is happening, especially just as you said, in different silos. We have to look at those interconnections
Hmm.
and the impact of that. Um, and so, thinking about that, I want to transition a little bit and talk a little bit more about like what does this mean, like the impact of all of this political chaos that's
Yeah.
happening around us, and all of these impacts and these decisions feel so heavy. How do we essentially stay grounded when we're in, like you said, the subfloor? How do we
Yeah.
how do we stay grounded and avoid chaos?
I
And
think it's hard, right? I think it's important to acknowledge that it's really difficult. There is no one way to maintain our sanity in this moment, right? It is it feels chaotic because it is chaotic, and I think that that's the first thing to really to admit and to own. And also our, I think about the ancestors that came before us. They lived through worse times than this, and certainly disruption and chaos to not just their bodily autonomy but so many of the things that we are also experiencing now, right? Disenfranchisement, disruption in our ability to actualize and to achieve our right of self-actualization, our ability to vote for the folks that represent us, right? Thinking about what that has looked like for centuries. It is not a coincidence that we are seeing assaults on democracy running in parallel to assaults on reproductive rights. When you can control the reproduction of an individual, you control entire communities. And another way to do that is to ensure that they cannot elect their own representatives. I know it's hard, right? Because I think often we realize that none of these folks are perfect, right? I hear people talk all the time about, choosing the lesser of two evils, and or not voting at all because they don't agree with the entire portfolio of the person that's put before them. I'm not here to tell you who to vote for and not to vote for, only to say that when I think about the sacrifices that were made for me to be able to show up at the polls, it is absolutely my responsibility to do so. It doesn't mean I'm not tired. It doesn't mean that I agree with everything that the individuals listed on the ballot have to say about, what the world should look like. But it is my responsibility to participate in the process. I know that we're headed into, the presidential election, and there are lots of federal elections that folks are talking about. I think it's important to also underscore how critical it is to vote in local elections, right? In your state election. So is the presidential election important? Absolutely. Yes, it is. And so is electing your school board representatives. So is electing the folks that sit on your city council. So are the judges that are running for reelection in this season. So are your state legislators and representatives. All of those folks are shaping our day-to-day life. And so the fatigue is real. The political fatigue is real. When I was, in addition to being a practicing physician, I also have a background in public health. And I was deciding whether or not at the time I wanted to do a master's in public health or a master's in public policy. And after spending some time on the Hill, I quickly realized I think public health is for me and not public policy, because it felt that like there was this big disconnect, right, from the lives of the people that they are charged with representing and the decisions that they are making. But that does not mean that I do not understand how critical it is to get in front of those folks, right? Both things can be true at the same time. We can be exhausted, we can be fed up, we can not like the person who is running on the ballot, and part of our responsibility is to get in front of them and to make our voices heard. We will not go softly into the night, right? I'm not one to suffer in silence, so I'm going to kick and scream all the way. And what you won't be able to say is that you passed this legislation that directly harmed my community, and you didn't know that that's what was going to happen. And so the work that we do, part of the work that we do at Physicians for Reproductive Health is just that. It's taking doctors who are advocates by nature. We advocate all the time for our patients, right? We advocate between parents and their children. We advocate with patients and insurance companies. We advocate all kinds of dynamics. And so advocacy is something that often brings people into medicine, along with the values that are deeply grounded in social justice. And we also recognize that doctors hold a lot of power and privilege. There is privilege in the white coat. And so really going before our legislators and saying, I'm a practicing physician, this is what this law means, this is the impact that it's having on my community, and we will hold you accountable.
I appreciate that. I think thinking about I'm now at the age in my mid 30s, and I feel like now I'm getting more of a lens for like policy and the political piece and how it
Mm-hmm.
impacts and functions and really molds our communities and our spaces. And I was thinking about it as I was kind of conceptualizing like this conversation, and thinking about like people are tired, like who's going
Yeah.
to pick up that mantle like when we put it down. Like I think inherently we're like, when I put this mantle down, another Black woman will pick it up and carry it. And I'm like thinking about like what that looks like, but also knowing that like I'm only starting to, or I would say I'm more at the beginning of my understanding of the political piece.
Mm-hmm.
And so I'm also starting to wonder, how do we get our youth activated and tied in
Yeah.
to like also getting in this space and
Mm-hmm.
activating and being and caring, and not thinking about that just the living for now kind of
Right.
concept, and like how do we just generate that energy at like the collegiate level that people are understanding. I absolutely believe that is happening more, but
Yes.
how can we activate even more youth within our communities around
Yeah.
this?
I think, I think you hit the nail on the head. I think it's critical for us Too often we hear young people being described as apathetic, and I think that that's absolutely not true. Young people are deeply engaged,
Yes.
particularly in social justice issues, and we're seeing this play out in this present moment across college campuses, right? For lots of different reasons. Young people are deeply engaged, both at the collegiate level, also in community, right? We see that every social justice movement that has made strides has only done so because young people were in the forefront. It is young people that we need to push us to say, absolutely, we need something bigger, bolder, braver, more daring than what you are offering. And so the first thing that I would say is young people are already engaged. They are already there. They are connected. Is there room for deepening engagement? Always. I think it's important, though, to really think about what engagement looks like, and how engagement can be shaped by organizing skills. And I think that's the piece
Yes.
that is missing, right? Disruption is not the only form of organizing. Now, and I say this as a disruptor, right? I am a disruptor, and I believe that there is a time and a place and a presence for that. But if all you're doing is destroying and you're not building, that's not revolutionary. That's not revolution. We have to do both. We pull down this system that is hurting and harming us, and we build something more. But it takes skills as an organizer to do that. There are a number of organizations out there that I think we can lift up that are doing amazing work. Advocates for Youth is a big one. They have for, decades brought young people into community, or gave them organizing skills to take back to their own community and develop many leaders. And that's a really good example of like a skill set. And so there's so many youth serving organizations doing amazing work. And I think that skill around organizing would certainly serve us all, not just the young people who are learning it.
Absolutely. I appreciate that. I'm just thinking about, like, I only started thinking about this and getting really activated now, and I wish I had a clear frame on it when I was younger.
Yes,
And so I'm trying to think about, like, how can I ensure that um that what happened to me isn't the same story of other people that
that's
are
right.
really passionate about this work, but don't know how to kind of hone that energy in a way that is actually impactful,
Yeah.
and meeting other people in alignment to continue to push that and move the dot on this.
I think
Um,
so. It's critical. The skill building those skills can be really helpful. But as you pointed out rightly, like part of it too is finding your community, finding your people. It's really hard to organize as an individual in a place where you're isolated. But believe me, if there is one person who is holding these beliefs, who wants to see change, who wants something different, one young person, then there are dozens
yeah,
there. And so being connected to a network of people that can help you navigate it is invaluable, right? Anything worth doing isn't done alone. And so building community and organizing is a big part of that. And really checking in with organizations that are designed to do this work in a way that is grounded in reproductive justice, I think is really key.
I really appreciate all of the jewels that you have shared today. And I can't let us wrap up without a call to action. So, what
Yes.
is our call to action, Dr. Parrott? What are your thoughts?
I would say continue to dream, right? Dream of what you want, not just what you don't want. It's easy to say, I don't like this, I don't like this, I don't like this, right? If anybody has like kids and you give them like, I don't want chicken, I don't want fish. But then when you ask what they want, they can't figure it out, right? It's easy to say what you don't want. So the first call to action I would say is to think about what you want, not what exists, not what you think you can get, not what policy you think you can pass. What do you want to see in the world? What does liberation look like for you? How can we rely on you to fight for our liberation if you don't even know what it looks like to you? If you don't even know what it looks like to be free. So to continue to engage in that process. What would liberatory abortion care look like? What would liberatory birth care look like? What would liberatory infertility care look like? What would liberatory parenting look like in our communities? And so practicing that muscle of dreaming is really important. The second thing that I would offer is a call to action, and I know people are tired. I know they don't like the choices. You have to vote. You have to. You have to. And I think that really recognizing that there is an opportunity when folks are elected to hold them accountable. Never forget that when folks are elected, they work for us. They are essentially our employees. And so they are accountable to us as well. And so when you vote to get people elected, then that does not stop there. Then you continue to press them to help you build that vision for the liberatory world that you want to see. So those are the two things that I would offer. Maybe one more. The last one, because we talked a little bit about criminalization, and this one I want to speak just directly to healthcare providers. Stop calling the police on your patients. Stop calling the police on
Yes,
your patients
please.
for suspicion of managing their abortion because you think they might be using substances that are criminalized, because you don't like, the way that they showed up and you think that they're disruptive. There is no room for carceral systems within medical spaces, and healthcare providers are some of the most frequent culprits. Now, I'm not saying that it's malicious, right? Often there's this idea that we think we're helping, we're calling CPS because we're trying to support the family. There is no support in this system. So this is not a topic that is related necessarily to what we were talking about, but only to say, if you're listening and you are a mandatory reporter, one, let's fight to eliminate mandatory reporting because of its racist and classist roots. But two, work to not act as an agent of the state.
Can I add one thing to that?
Yes.
Get to know your community organizations that are
Please.
able to offer support.
Yes.
Don't lean into the carceral state, like Dr. Perritt
No.
said. Get to know the community organizations already doing the work within the community. Get to know them by name, so that when you're able to refer people to support, so that people can be held from within their own community.
That's right.
With people
That's
that
right.
already have established relationships. So
Thank you for adding that. That's so critical.
absolutely.
This is not an ad for healthcare providers to create new systems. There are already organizations that are doing amazing work in our communities. And so we cannot be in the community and not of the community. It is your responsibility to know your community if you are going to care for them.
Well, thank you so much, Dr. Perritt, for taking the
Mhm.
time to chat with us today and leaving us with such an amazing word. Um, More to come. If you are looking for Dr. Perritt, please make sure you follow her, and also follow Physicians for Reproductive Health. They are doing the work, y'all, and they are fighting for a better tomorrow, the tomorrow that we're all dreaming of. So we will continue to be in relationship with them, and we will see you all next time. Thank you
Thank
so
you.
much.